Okay, this is for pre-op evaluations. A lot of times a patient comes in, they're having a surgery by one physician, but their primary physician needs to do a pre-op evaluation to approve their surgery. So the guideline tells us for patients receiving those pre-op evaluations, you're going to sequence first a code from subcategory Z01.81. This is an encounter for pre-procedural examinations. So if it's a pre-op consult, you're going to have to assign Z01.81. Then, as additional diagnoses, you want to assign a code for the condition that describes the reason for surgery. So if this patient's having cardiac cath, that's going to be an additional diagnosis, the diagnosis such as chest pain, because the cardiac cath is going to be an evaluation of seeing the determination if there's any blockages or anything. So that patient's having chest pain, they're going to have a cardiac cath, and he just wants his primary physician to do an evaluation to clear him for surgery. All right. So the surgeon will want and then which is what I've just described. So if you have a pre-op evaluation, and it's going to document in the chart pre-op evaluation Z01.81. This is, and as it told you here, this is subcategory Z01.81. That lets you know that that's not a complete code when you see the word subcategory. So if I come over here, I see Z01.810 for pre-op cardiovascular exam. And then the 811 would be a pre-op respiratory. All right, so Lucy is an 8-year-old who was brought into Dr. Adams' office for a pre-procedural consultation for a mass on her left lung. Dr. Adam reviews the patient's x-rays and MRI, which were taken the previous week and sent from Dr. Goodman, which is Lucy's pediatrician. So without looking in the code book, what Z code, the question is, what Z code would you report for the pre-procedural consultation? Well, we have it here because I provided it in an example, the Z01.811. So that's going to be a pre-op consultation, left lung. Lung is in our respiratory system, and that's how we determine the specific examination. So Z01.811 is going to be our Z code. And then we're going to report a diagnosis code for the lung mass. And then the question is, which one's first? Well, we know that Z01 is going to be our first listed diagnosis. So you want to look in your code book at Z01, not code book, I'm sorry, in your find a code, Z01, and you want to go ahead and just look through that. Just get familiar with what all is in that subcategory. Because this patient has a lung mass. She's 8 years old, she has a lung mass. So this is a respiratory pre-op. For the cardiac cath, it would have been 810. So it depends on what the type of surgery being performed is going to drive your code for your pre-op evaluation exam.